So I would love for all of us to introduce ourselves, and I will call out your name. If you could just share who you are and what you do, that would be great. Megan.
Good morning, everyone. My name is Megan Albanese. I am the prevention coordinator for the town of Southington and the STEPS Coalition.
Deepa.
Hello, my name is Deepa Kamingay. I'm a pediatrician and addiction medicine specialist. I'm at Yale School of Medicine. Thank you for having me join today.
Carol.
I am Carol Rush, and I'm the school psychologist here at Ram High School.
Kevin.
I'm Kevin Dantzler. I'm a juvenile probation officer for the state of Connecticut.
Deborah.
Good morning. I'm Deborah Lake. I work at the Governor's Prevention Partnership, and I'm our Director of Program Planning and Implementation.
And the person who will be facilitating this discussion, Tressa.
Hi, my name is Tressa Giordano. I'm Director here at AHM Youth and Family Services. I want to thank everybody for coming on. I think that this discussion is so important for our community, and our goal today is to, have some conversation about kind of what you all are seeing in the work that you're doing in the community when it comes to youth and cannabis use. And our hope is that we're able to put this recording on our website to give parents, educators, those in the community, just a resource that they can have to hopefully educate themselves and maybe just be able to guide their youth if they have a youth in their home right now. So we've asked you all to kind of think about what key information you would like to share with parents about youth using cannabis. Specifically as it relates to your field. So what we thought we would do is we would ask each of you just to kind of reflect, maybe get a little bit more information about your role within the community and what you're seeing. So I don't want to have to put anybody on the spot, so I'll just open it up. Would anybody like to kind of jump in and go first today?
I'm happy to. Oh, okay. Go ahead, Kevin. No, you go, Kevin.
So I'll start first because I think before we start this conversation, it's probably best to get a grasp of what the actual law is and then how that pertains to juveniles. I think that'd be a good basis to start, and then we can kind of branch off of there of how we can work with these youth and help them. So what I'll start off doing, I think it's the best way to just, state what the law is actually. And I'll start with what it is for the adults. That way we can understand how that translates down for the juveniles, okay? So as of July 2023, as we all know, or some of you know probably, the laws were changed for marijuana, and they were changed in a way where it was decriminalized. So the penalties have scaled down much more than it has been over the past several years. But I will state what the Connecticut General Statute states. The law is section 21A-279A, and it talks about the limits of legal possession for cannabis. And I think that due to the decriminalization, it has affected our juveniles, significantly, because they are now able to get, very easy access to it, and the penalties aren't as severe as they were in the past. But what the new law states, basically, and I'll start with adults at first. So any person 21 years of age or older, they may possess or use cannabis products, provided by the amount does not exceed someone's possession more than 1.5 ounces of marijuana. So as an adult, you are able to walk around on your person with 1.5 ounces of marijuana legally. You are also able to carry an additional 5 ounces of marijuana that is locked up. Okay, so that can be locked up in your glove compartment, that could be locked up in your trunk. Okay. So totally, we're talking about a person legally as an adult, they can be, driving around or have on them, if it's locked up to about, 6.5 ounces of marijuana. That marijuana possession also includes marijuana substances. Okay, so that can be in the form of concentrates, which is known on the street as dabs. edibles, the products that you consume, those are also considered as marijuana products. So that amount of cannabis is legal, for an adult. So how that translates to juveniles, it's also decriminalized since it's decriminalized for the adults. So the penalties aren't as harsh for the juveniles anymore as well. So let me go into what it means for the juveniles. Any person that's under 18 years of age who possesses or has under such control of less than 5 ounces of cannabis or plant material equivalent to the amount of cannabis products as provided, their first offense will be issued a written warning. Okay, so if a child has under 1.5 ounces of marijuana on them, by law, they are to get a written warning by the police. Okay, so I want to emphasize that it's very important that when these children are caught with this marijuana, that the police must document this, okay, because that leads to the severity of it later, should this be a constant offense for one of our youths. Okay, so the first offense will be a written warning, or that child may be referred to a youth service bureau, such as one of our JRBs or another facility that can help with our youth. Okay, so that's for his first offense, but this has to be documented by the police. Okay, because if it happens again, we need to have documentation that, okay, this kid's already received a warning, and we need to, issue further consequences. The second time, it is mandated that they be referred to a JRB. So the first time you get a written warning, and there's discretion if they can be referred to a JRB. The second time, it has to be documented by the police, and they are required to attend a youth service bureau. Okay. Any subsequent offense after those 2 warnings, that child may be adjudicated delinquent pursuant to the provisions of this section. So what that means is, after the first warning, okay, they have discretion, okay, to go to the JRB. The second time, they must be referred to a youth service bureau. These have to be documented. The third time, then they will be adjudicated at court. Now, if that child is adjudicated here at the court, he will go through what we now have as a screening process. So since these laws have changed, we also changed how we deal with juveniles as well coming into the court. So if a child comes in for possession of marijuana, we do what we call a screening assessment. It's called the PREDICT. And we will screen that child, and based off how that screening comes out, it gives us kind of a guide on how we need to handle the case, okay? And when I say handle the case, it can go one of 3 ways. It can go to the judge, what we call judicial handling. It can go non-judicial supervision, which is not probation, but it's a form of supervision by probation, where we'll monitor the kids for a certain amount of time and, try to help them with the issues they're having and try to make sure, they stay out of trouble. Or we can divert it, which means we can send it back to a youth service bureau. Okay, so those are the 3 ways that it goes, depending on that PREDICT screen. Now, what happens with that, a child, he can continue to possess marijuana and get adjudicated to court, and he will have the opportunity to have that screening, okay? So a child can get caught 20 times with marijuana, and he can come here and be screened 20 times, and we will have to use, one of those 3 options on how we will handle it. Okay, so that's how it affects our juveniles. So that's where it gets a little tricky. Okay, so I think these kids are kind of understanding what the laws are now and kind of knowing what they can get away with and knowing what the repercussions are. And along with the easy access to the marijuana is causing this phenomenon of vaping and kids smoking and such. But those are the laws. So since it was decriminalized for the adults, it transferred down to the juveniles, and they are now decriminalized for possession of marijuana. if that makes sense. And I can clarify, any other questions you guys might have on the law, but that's kind of it in a snapshot. These kids, they can get unlimited cracks at the apple for possession of marijuana coming into the courthouse. It's unfortunate, but times have changed, laws have changed, and that's how we have to deal with these situations.
So
All
if
right,
I could
thank you.
piggyback off that just a little bit, Kevin, thank you for sharing all that. It's all
Yeah.
such important information. And the part that I want to add to is that the access that you mentioned, and ease of access for our youth right now is unbelievable. We have a town ordinance here in Southington where the sale of adult use cannabis is completely prohibited. However, we did compliance checks last month, and 3 out of 7 stores failed for having cannabis products in their store. And we can seize the materials, and we can work with the Department of Public Health, and we can work with our amazing police department, and we do all that. But the fines are so minimal right now for merchants that merchants are almost willing to take that fine, clean everything up nice and neat, and then put it back out. So we're seeing students in Southington walk into vape stores and, first of all, buy underage illegally nicotine if they wanted to, but now cannabis too. So we've obviously all seen in our communities a huge uptick in vaping, and now a huge uptick in cannabis vaping. I run an intervention group at our high school on a monthly basis. I never have less than 10 kids in that, and that's for any student who has been caught with any kind of substance. They're all either nicotine or cannabis. And now I'm seeing it in the middle schools. So where I haven't had to have consistent intervention groups at the middle school level for the past 3 months, it's been consistent in both of our middle schools. So we know the access alone and the perception of harm is completely going down. We surveyed back in 2022, and we're waiting to get our survey results again this any minute. We just surveyed in February this month. And the perception of harm that youth are seeing with cannabis is tanking, just completely tanking.
So I'm glad you mentioned that too about the fines, because they're so minimal. These people are willing to take the risk because it's it's really a slap on the hand. So let me dig into that. I'm glad you brought that up. So I'll talk about the law with the fines too. So a person that is 18 years of age, but under 21 years, who possesses and has 5 ounces of cannabis material greater or equal to, they shall be required by law to view and sign a acknowledgement of health effects of cannabis on young people. Okay, so basically, you get caught with over that amount, you have to sign a statement saying, I understand the effects of cannabis on youth. Okay, that person, so that's for the first offense. For the second offense, this person gets caught again, they are fined an amount of $50. Okay, any subsequent offense after that, they will be fined $150. So that's a minuscule amount for somebody who was selling cannabis, at a high rate. They can make that in, 2 minutes. Okay. So those are also the fines, for somebody under the age who continues to be a constant offender. Somebody who's over the age of 18 and 21, their fine will increase slightly. Okay, so for their first offense, they'll be fined $500. For any subsequent offense, it'll be a Class D misdemeanor. Okay, so it kind of increases a little bit over the age of 21, but those are the fines that we're dealing with.
Yeah, thank you for sharing that. What I notice as a healthcare provider, talking a lot to kids and parents about the laws, there is still, people are not quite understanding all these nuances. And one thing parents seem to be confused on is whether they themselves legally can share cannabis with young people in the home or wherever. I know there's some, you know, social hosting or sharing laws around that. There seems to be an idea, at least where I work in the community, that that is allowable in the home. So I'm talking about, you know, having children use in the home, the parent supply. And unfortunately, what we're seeing is some kids are doing that. In fact, they're using the adult supply that is present through, you know, either relatives or friends of the family. Um, and they perceive that because it is a legal product to be safer than what is available through peers or other means. So I think that's also contributing to reduce perceptions of harms, that the legal products being considered different than products available through other means.
That's such a great point too, as we hear more, excuse me, more and more about, if anybody has watched the news lately and heard about the THC seltzers. There is a federal and state loophole right now where anybody, no age restriction, can walk into any kind of convenience store, bodega, and buy a THC drink right now that is 5 milligrams or less THC, and there's no policy around it. We're scrambling to get a policy in our high school that includes CBD right now, because the way our policy is written, our kids could bring these seltzers into the high school and have no repercussions with it. And it's just that kind of normalization that we're seeing of the adult use cannabis, and parents wanting to share that with the youth.
I would join in on that as well. I think that before, when we did our surveys 2 years ago, a big thing for students was that what their parents would think if they were using drugs, and that had a huge impact on them. And now that it's legal, some parents are doing that, and now they're thinking that it's okay and it's not a big deal. And some are self-medicating for anxiety or depression, and they're kind of hooked, and now they're looking for a bigger high. So it's like an avenue to bigger drugs. And that's my concern, that we've called it recreational. So it's no big deal. It's a sport. It's something you do, you know, on your time off, like recreational sports. And they don't see the seriousness of it because the adults in their world, excuse me, have toned it down. They don't think it's that serious anymore because we legalized it. So my concern is that the next time we do our survey, the usage is going to go up, you know, because at 2 years ago, it was actually down.
Carol, you bring up a great point, and I just lost my train of thought, so I'm sorry, I'll skip that. Sorry, on a recorded call, lose my train of. Oh, sorry, I know what it was. I know what I was gonna say. It's about the language too, right? And getting everybody using the same language. So my coworker and I are part of a team actually to kind of get that recreational word out of cannabis use, and really pushing people to say adult use cannabis. We wouldn't say go have a recreational beer or something similar with alcohol. So we're really trying to work on that in the prevention field to because when you say recreational, it brings a certain normalcy back to it, right? Like everything you mentioned, like the sports, and just makes it a little less scary.
Yeah, it's okay, you know, and it's not.
You know, as JRB case manager, I've had several students who were arrested for having possession of marijuana or THC. And it's super important we go through the JRB process to educate them, because they really don't understand what the risks are. They don't really understand what the consequences are. And just like Carol said, you know, they are self-medicating themselves for, you know, anxiety, depression, and they need to have that. You know, what we've tried to do is just to share with them and share videos with them, you know, acknowledging, you know, marketing has had a play in why you are using it. And they don't even understand that it's the old marketing for cigarettes, and cigarettes were wonderful. And this is, you know, how you should be living your life smoking. Well, fast forward several years and you find out that they're deadly. So it's all about the education. And I think by doing this video, by getting it out to the parents, because again, there are parents that are making it very accessible for their own children to access this, and they don't understand the consequences. AHM has smart recovery at our high school. It is done every single week on a Thursday. It's rotated through the lunch waves. It is a valuable resource for anyone who has any type of addiction, marijuana, shopping, anything. So this is something that we try to get out to the youth. During prevention week, one day I asked every single student that came to my table at lunchtime, do you know what smart recovery is? And they said no. And this was an opportunity to say, hey, this is something as a resource. So again, education is key. We do it. Carol does it. Kevin, you do. We're all doing it. So I'm hopeful that this video will definitely help.
Yes, and so I just want to add, as far as AHM goes, I know, Megan, you mentioned that, you have some recent survey data that you're using in Southington. So AHM, through our drug-free community grant, will be doing another survey in the fall of 2024. And so, as Carol mentioned, I'm interested to see the answers to the questions around marijuana use and perceived risk. Unfortunately, I have a feeling that the results that we had 2 years ago, especially around perceived risk, is going to look a lot different in the fall. And so I think when we get that data, we're going to really have to analyze that and do more work in the education of that. I know, just in circles out in the public, I feel as though two things are happening. One, you smell marijuana a lot more. And so that becomes a question, even with little kids. Oh, what is that smell? And I think as parents, we need to tee that up as an opportunity to have a conversation about that being an unhealthy choice. I also hear a lot of talk of adults about use of gummies, almost like it's an everyday thing. I'm going to go home and take my gummy. I had a tough day. I'm just going to pop a gummy when I get home. And these conversations are being heard by children around us. Just the fact that it's a gummy as a kid, you're thinking that is some kind of candy or, special kind of fun fruit. So again, it's so much in the wordage that we're now using around cannabis that is creating this perception of it being fun and safe and okay. And I think we have to really think about the message that we send as adults.
Well, we as parents give our children gummies for vitamins. So the kids think it's good for you. And here we are packaging, marijuana in gummies. Or we went to a conference and they were showing us the packaging that looked like Cheetos. You would think it was a Cheetos package and it wasn't, so they're really, going for our youth and just making it very alluring. We want to do this.
And I think as you're talking with teens, when you kind of explain the business end of marijuana and cannabis, right? Like, these are huge companies that are trying to hook you as a teen, so you are a lifelong user. And we know that there's going to be medical consequences perhaps down the road if you continue to use cannabis. And I think sometimes when you're talking to teens, when they understand, like, you're being tricked into doing something that is going to have lifelong consequences, sometimes they look at that as like, wait a second, that's what's really happening. Like, that's not cool. Like, what, these companies are doing that. So as Jen was saying, we know that this happened years ago within the cigarette industry. It's really history repeating itself, using all of these terms that are very candy-like and fun, and teaching kids, like, wait a minute, you be in control. Don't be duped by these billionaire companies that don't care about you. Thank you, Megan, for putting that information in the chat about lock bags for storage of cannabis in the home. We will put that on our website. We also here at AHM, as far as pills go, we do have locking pill bottles that we give out a lot of times at our take back events, but we can give residents, those as well.
The clearinghouse also has some pill disposal. Another great resource that the state of Connecticut has been putting out is their Be in the Know campaign. So that's a great place to answer questions, also get materials. And the real idea is just because adult use cannabis is legal, it really doesn't mean it's safe, and as you were mentioning, it is important just to have those conversations with really young children because they see everything, they know what's going on, and it's not too early to have those conversations about, even I have a 5-year-old and, she's already like, oh, smoking's not good for you. That can hurt my lungs. I want to be able to run fast. It doesn't have to be more complicated than that. But we've already started that. And, I think that's one of the biggest things of, a lot of data does also show that the young adults overestimate how frequently their peers drink alcohol and use cannabis and do those sorts of things. And so it's continuing to, bring in those opportunities as a parent, as a caregiver, as a mentor, as a neighbor, just those small things of like, hey, here's healthy choices. Hey, to be able to perform with your athletics, to be able to perform with your extracurricular activities, keeping your body healthy, allowing your brain to develop positive, in the right way. It does show that young adults, can very much get addicted. I think a lot of people are like, oh, cannabis, you can't get addicted. Young adults can. And it really leads to a higher possibility of things like schizophrenia and anxiety and depression. People try to self-medicate, but really it can backfire. So I don't know if Deepa, you have additional thoughts
Yeah,
on that.
I think, I wish people could see what we're seeing in the hospital setting in terms of cannabis and how it's impacting children. So the importance of I'll start with younger kids, lock boxes. I can't stress that enough. So what we see are toddlers, unfortunately, who get into a parent's supply, and they will present extremely they appear like they are in a lot of pain. What we think is they might be hallucinating or experiencing something, and they're not able, as an infant or toddler, to voice it. It can be so extreme that we have to intubate, put a tube in their throat and sedate them because they are so distressed and unable to understand why this is happening, nor to explain their symptoms. It's sad. It's sad to see these children in the cribs, in the ICUs. We're literally watching them, waiting for it to pass through the system. I don't think any parent wants that for their child. It's hard for us to watch on the sidelines as pediatricians. And I really, really encourage parents to take it seriously. This isn't like a once in a lifetime event that happens. We see it, we see it regularly enough that we just sort of know to expect it as part of our beds in the hospital. As kids are getting older, we are in like elementary school students. Parents may have edibles or other gummies in the home. We do have cases of children unknowingly bringing it to school and sharing it with a friend as a candy. And so young school-age children becoming similarly intoxicated, they present with, severe vomiting and paranoia as well. They're better able to express it, and we're better able to explain to them, why it's happening and reassure them. So, a message I try to tell my own children, especially school age, is like, right, unfortunately, because we see this, don't take food from somebody unless an adult says it's okay. We've come to that. Like, you can't bring in something to share with your friend with good intention. It should be wrapped. And when they were like in second and first grade, it's like, it should be, check with an adult before, taking someone else, whatever food or candy that they're trying to offer you. Then we get into the teenage years, and something that is unique is that the concentrations, as was mentioned, of THC are extremely high now. And we do have this phenomenon every day in the hospitals. There are 1 or 2 children, teenagers, admitted with something we call cannabinoid hyperemesis. So we don't actually know why this is happening. When I was in training 20 years ago, never. This was like, if somebody had this, it was like everybody would talk about it because it was so rare and only in textbooks. I never actually saw it. Now it's like every day there are two kids in a hospital unit with this. So what happens is that, and we don't know why this happens, which is also frustrating for the teen and their family. Some kids who use cannabis develop this syndrome with severe abdominal pain and vomiting. When I say severe, I mean like they come into the hospital and their blood electrolytes are off. We have to, like, they technically, if not treated, could die from a heart arrhythmia. So this is a severe sudden onset vomiting. And then they are in extreme pain as well during the episode. And we didn't see this years ago. It's because we think it's because of the nature of the cannabis that is available in stores as well as through other means. And it's very difficult for a parent to watch that happen to their child as well. These are kind of unique impacts on children that I think parents need to be aware of, because I really don't think they want that for their kids. But as a pediatrician, I can say it's kind of commonplace now for us to see these things. And I just, in my view, like, just take this seriously, locking your materials and speaking to your kids, because there are some really serious consequences. Not life-threatening. We have medical care, which is great, but it's really not pleasant to see your child suffering like that.
The conference that I attended, they told us that 70% of the kids that they see got their gummies or their THC from their mother at home. So, it's there, it's not wrapped, it's mom or dad, and you think it's safe at home, and this is what's happening. So it's not safe, so it should be locked.
I want to just go back to, and I don't know, Kevin, if this is putting you on the spot, but as far as social host laws go, I know that we, try to talk to parents, here in our area about that as much as we can. But can you speak to, what the consequences for adults are if, they are in fact hosting, an event where, marijuana, alcohol is being served? What could happen on the parent end of that? Because I think the mindset of some parents at times is, oh, if I host something at my house, then I'm ensuring that the kids are safe and I'm going to take keys and nothing's going to happen. But we know that that isn't always the case, and that, just in keeping, you're thinking you're keeping your kids safe, there is still a liability and criminal charges to a parent that is hosting such an event.
Yes, that is correct. So any distribution to minors of any controlled substances or alcohol, in fact, is a crime. So if a parent is caught doing that, that constitute, I believe, as a felony charge. So it is not legal, even though it's decriminalized, to distribute any controlled substances or alcohol to any type of minors in no shape, fashion, or form.
We did have a case recently with our JRB where it turned into a DCF referral of adults providing cannabis to young people, and DCF picked the case up.
Thank you.
Yeah, when I picked it up as a healthcare provider, Child Protective Services, or DCF, does take it up. That is a known thing that could happen if your child is reporting this, or you mention it yourselves. We're mandated by law actually to report this due to concern of harming the child.
Definitely.
Thank you. I think, the other topic I just want to hit upon, and anybody can jump in, but we do seem to interact with students that are feeling as though use of cannabis products does help them with their mental health. And I think we need to be conscious of the fact that, our youth are going through a lot of, really tough things, especially coming out of COVID, with feelings of isolation, maybe feeling disconnected. And so, just thoughts around mental health and use of cannabis and what we can do to hopefully give our youth other choices, other avenues, other resources, so they don't feel as though that is their only choice to help them with anxiety and depression. Just kind of open that up.
Yeah, so I'll speak to that a little bit. So in my field, with the decriminalization and the easy access to the marijuana, it makes it extremely hard to work with my youth. I work with many youth who have severe mental health issues, and they do not want to use their prescribed medication. And by law, constitutionally, we can't make them take their medicine. So they will self-medicate primarily, with marijuana, the youth that I work with. And, I try to push for education the best I can, because what happens a lot of the times is the use, as mentioned earlier, of the marijuana is backfiring and is causing their mental health to trigger even more and to act up even more, which causes them to commit further crimes or get into, other situations that lead to further court involvement. And, what they tell me is, it makes them feel good. It helps them with their anxiety, helps them with the depression, it mellows them out. And what I try to do is I just try to educate them as much as I can on, how the effects, especially with use, can enhance their mental health and can backfire and can trigger, the mental health that they're having. We do have some programs, within the court, NAFI link program that, I will refer youth to that can kind of, help further educate them, on the use and what they're doing. But a lot of the times what I get is it makes me feel better than the medicine that I have. The medicine that I'm taking makes me feel like a zombie. I don't know who I am. It dulls me out. And they go right to the cannabis. But in actuality, for the most part, it's hurting them and it's triggering more hospitalizations I see with my kids and enhancing their mental health. So that's a big fight that I have with the youth that I work in, with the cannabis in regards to mental health. So I just try to continue to educate them, provide them with education, try to put them in, any resources that we have. Unfortunately, in this area, resources are very limited. But I just try to keep pumping education with them, and hopefully, when some of them, it kind of shed a light on there. But it's a tough fight, especially with the delinquent population and mental health.
As far as my role as prevention coordinator, I also co-facilitate a SOAR Youth Leadership Group with Carol at Ram High School. This group is not only for high school students, but also for middle school students. And every year we get together and the students put together a calendar of events for our meetings. And it's incredible because both last year and this year, the types of things that they wanted to do was all under the umbrella of, self-care, which is super important. So we kind of take a look at, we're getting this group together, which could be considered, goody goody because we're, we don't want to have smoking or drinking, but we're kind of coming through the back door and using self-care as a way to get only not our students that are members of this group, but also inviting members of the entire school population to these events. So maybe someone never did watercolor, maybe no one sat down with maybe a Sharpie with some, crayons and colored. There's other ways that you could fill up your days and to do different activities. And what we strive to do is just give opportunities for these kids to maybe learn how to meditate. And these little skills, we think we're just planting these seeds in these children's brains that when they need to, take some time for themselves or to make a choice about doing something or relaxing a different way, they can fall back on, what we're providing for them. It's not easy, but we keep doing it, and we'll continue to do what the kids say. But right now, it's all about self-care.
I also think providing our students with a mentor or a person that they can go to and feel comfortable in talking with. Our policy is always an open door policy here in guidance. Whenever you need somebody to talk to, support, we have it here. We also have the Smart Recovery, like Jen had talked about earlier, as a support group, and also the connection between services between AHM and school, very important connection. Myself and outside providers and all other agencies that we work with to try to prevent them from, going down a worse path than they already are on. And to also go along with what was said earlier, it's, I see students who said exactly what you said. They start using the marijuana to self-medicate, and then they're looking for that high, that escape, and not only to match that first high, but they're looking for a better high. And that's where I'm concerned that they're looking toward other drugs. And this is just the first step in many down that path of drugs, and also getting in trouble with the law in other ways. So
Yeah,
I think it's very important we all work together as a team.
Yeah, it's incredibly important for our students to know that they have a trusted adult, whether it be in the guidance or in the front offices, but even to reach out to their teachers or coaches. I mean, anyone for whatever reason, if you find someone who needs help with maybe vaping or suicidal thoughts, anything, it's so important. During Prevention Week, again, you focus on one question that you want to ask those students, and it was, who is your trusted adult? And some of them would just tell me who it was. Others would have to go, what do you mean? And it was just kind of coming to light saying, you should have a trusted adult. And they're like, oh yeah, this is the person. One student my entire time asking that question said, I don't have anybody. So I'm thankful that students do have trusted adults, and we just have to work on those students. And I think we all know the students that need a little bit more help than others to let them know that they do have someone.
So as part of my work, I see teenagers who have been taught in school vaping, and they may, I think parents are really, really influential in having kids stop. I have kids, yes, they're using it for mental health concern and other reasons. But the biggest motivation they have is that their parent really sat them down because they found out, and they talked to them, and they're like really serious about not their child not using. And that is their like only motivation to begin with to stop using cannabis. Then as we work with them, we make these links with mental health and other things and putting in the other protective factors for them. But parents really are so influential for, and I feel like, you know, as a parent myself, it's a big responsibility, but I've seen some being like, well, it's just cannabis, it's just marijuana, it's just, but you really have such a strong influence on your child during these teaching moments. Um, and so, thinking of how to deal with it if you see your child using or find out, thinking about it as a teachable moment for your child that potentially could change their trajectory later on, because you're very powerful. What you think and the rules that you set in these moments are extremely powerful for the child.
I totally agree with you, Deepa, with working with students in the JRB. There is such a difference between the students that have parents that are supportive
Yes.
of not only the process, but they take the time to educate their students and they are supportive of their well-being and
Yeah.
they are clear with what those expectations are. There's the other side where you have parents that, for whatever reason, and there's a lot of complicated situations with family dynamics, and there isn't much attention with some of the other students. And there's a direct correlation in how those students do within the JRB. So, the one positive thing is when they are involved with, at least I know our JRB process, they are ours forever. We always welcome them to our programs. We make a point of just saying hello and to reconnect with them at the high school level, to invite them to the youth leadership, meetings, and to just make sure they always know that we are there for them and that we're supportive of them. It's an important message for the youth to let them know that they're cared for.
Yes.
I couldn't agree more. But I've been noticing a lot with our youth, not understanding that sometimes when parents put limitations and boundaries and the tone of their voice may be angry and scary, that the parents are caring enough to engage and they're feeling so much about what's happening that they come across um, as not caring to our youth. And they're having a really hard time navigating, understanding that parents care and that's why they're reacting the way they do. And maybe they're frustrated or they don't know what to do themselves. And that's what's coming across. Not that they don't love, care, or want to help their student, but the students are interpreting that as they don't care, they're angry, they've given up on me. So I really want people to understand that they have to kind of explain what their reaction means to their children, so that the kids get the right message.
Good point.
Well, I want to thank everybody for coming on today. I really appreciate you taking time out of your day. I know that you all are very busy, but I feel that the information that was brought up in just this short 45 minutes is hopefully very educational and informative to the parents that are watching. I do want parents within our area to know that you are always welcome to reach out to our staff here at AHM. We do offer individual therapy, family therapy. We have AHM employees in every single one of the schools that we serve in the 4 towns that we serve as YSB for. So we have staff there to assist you, to answer your questions at any time. We do offer QPR and Narcan training, which we didn't really get too much into, but I think it's important to know QPR, is a suicide prevention gatekeeper training that we offer here free of charge at AHM. And we do certify folks to have Narcan on them and to use it if needed. And I think that's, maybe a topic for another day, but just to know that that is a service that we provide for our residents and anybody in the area. We don't just do QPR and Narcan for our residents. We want everybody to take that training. I highly recommend as a parent, if you have questions, reach out to the people around you, the people at your schools, AHM, your pediatricians, because it is hard. It is hard to raise children within the environment and just the time that we are in. And so don't feel that you have to do that alone. Ask questions, find those people around you that can help you to give you advice. Because I think we do live in a community where everyone cares and wants to support. Sometimes it is okay, right, to make those connections and to reach out and ask for advice and help. But again, thank you so much for your time. We appreciate it. I think it's always great to hear different perspectives. and advice from those that are working with kids each and every day. So again, thank you so much. And parents, feel free to reach out to us at AHM anytime.
Thanks for having me.
Thank you very
Thank
much.
you very much.
Thank you.
Thank you.